Clinical Innovations is a division of Labrie Medical and is focused on the care of mothers and babies. The traxi Panniculus Retractor Extender provides a simple solution to a big dilemma. Traxi is designed with the patient and healthcare provider in mind. Traxi quickly and easily retracts the panniculus in high body mass index patients during any abdominal procedure. The extender is intended for use with traxi on patients with a body mass index greater than 50. However, it is dependent on the patient's anatomy and need for retraction than on the calculated body mass index. The top part of the extender is placed on the sternum with the midline arrow pointing towards the patient's head. Remove tab A backing and apply panel A to the sternum between the breast near the sternal notch midline. Use B tabs to remove the B panel backing. Have an assistant push the panniculus upward toward the sternum, creating optimal retraction of the panniculus. While holding the panniculus in optimal retraction, apply panel B to the original traxi, thus creating a new anchor point. If desired, traxi, as well as the extender, can be left in place for up to 24 hours, which may aid in post-operative airflow and wound assessments. Application and removal of the traxi extender are both quick and easy. Begin at the top. Peel the traxi extender and retractor down away from the patient. Ensure to remove it slowly while supporting the skin. Traxi offers predictable, reliable retraction.